Good afternoon. I'm Pat Living with the Department of Health and Social Services and moderator for the COVID-19 update for Wednesday, September 23rd. We're joined today by Yukon Premier, the Honourable Sandy Silver, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Our sign language interpretation is being provided today by Mary Thiessen, and André Boursier from French Language Services Directorate will translate any questions from French-speaking journalists. Following our speakers, we will go to the phone lines for questions from reporters and then to the reporters here in the room. We will call you by name and you will each have 2 questions. Before we begin, I'd like to verify that everyone can hear us. If any of the reporters are having a problem, please email Alexis Miller, M-I-L-L-E-R, at gov.yk.ca. Premier Silver?
Thank you very much, Pat. Hello, everybody, and thank you for joining us again today. It's great to be back here with Dr. Hanley and with Mary on the traditional territory of the T'Anquatchon Council and the Kwalintun First Nation. Over the past few weeks, I've been traveling around the territory, visiting communities, to check in with people, with municipalities and First Nations leadership. I've been to Dawson City, to Beaver Creek, Haines Junction, and Watson Lake. Had many great meetings with different folks, including the new Chief and Council of Liard First Nation. We've also been meeting virtually with leaders, including Teslin and also Ross River. Each community is dealing with unique challenges related to the pandemic. Watson Lake, the gateway to the Yukon, is on the front line when it comes to visitors into our territory, those transitioning through it on their way to Alaska as well. The team of enforcement officers working in and around Watson Lake and Junction 37, they are doing a fantastic job keeping travelers informed about the current situation in our territory and the responsibilities of those who are entering to visit or on their way through to our neighboring jurisdictions. I also visited Beaver Creek with Minister Stryker on the other end of the Alaska Highway. Beaver Creek is seeing a lot of American travelers on their way to Alaska, and they are doing a great job keeping the community connected and protected. We have had more than 48,000 travelers enter the territory over the past few months, including more than 18,000 non-residents transiting through our territory. Even with all of these travelers, we have not seen any cases related to people traveling through the territory. We are very fortunate to be in a position that we are in, and I want to thank everybody for their individual efforts on our behalves. I especially want to thank Donna at the Visitors Information Center in Beaver Creek for her warm, welcome, and engaging conversation. Donna is a character, and I love characters. It's not been a normal year in terms of tourism, but our tourism staff continue to do great work and continue to keep visitors informed about the territory and how to travel respectfully through and in the Yukon communities during the pandemic. To all the VIC employees, thank you very much for your service and your adaptability. It was also really impressive to see how White River First Nation community is working together with the Canadian Border Services agents officers stationed in the Yukon-Alaska border to support them and to keep up their spirits. The border service agents, they were all wearing the fireweed hero pins beaded by community members in Beaver Creek. These are the same pins that the volunteers have been making for all the frontline workers across the territory to support them as they do the critical work they need to keep our communities safe, protected, and connected. Dr. Hanley, I, and Mary are ASL translator. We all have those pins, and I must say, they really are a source of strength for me and others as we wear them. The last 6 months have been challenging for everyone, and we know that the pandemic is not over yet. These fireweed hero pins represent the strength, support, and community spirit that contributes to our territory's resilience and makes Yukon such a great, fantastic place to live. I want to give special shout out to all of the beaders who have taken the time to make these beautiful pins because they really mean the world to those who wear them. Throughout my community visits, I was so impressed by the way the communities are coming together to support one another and to adapt to the new normal that we all find ourselves in. It's not just the communities either. It's the Yukon business community as well. Local businesses have faced unprecedented challenges this year, and they have shown incredible courage and determination to adapt to a new landscape that we all find ourselves in. My colleagues and I, including Ministers Pillay and Ministers Dendies, have been in close contact with Yukon business community to hear their concerns, to identify challenges, and to find opportunities to support our local economy. Throughout the pandemic, our government has recognized the need to support local businesses, and we will continue to do so. We introduced several programs, including the Yukon Business Relief Program, to support local businesses who are the heart of our economy. This program has helped hundreds of businesses in our territory to pay their bills and to stay in operation. Minister Pillay will be sharing more information about this important program tomorrow. We also changed the Yukon nominee program to help with nominees that are faced with layoffs or with reduced hours. The Yukon Essential Workers Support Program provides temporary financial support for low-income workers delivering essential services. Another important program we introduced is the Paid Sick Leave Rebate Program, which allows Yukon workers without sick leave to stay at home for up to 10 working days if they are sick, related to having to self-isolate. It also is available to those who are self-employed. This is a very important program designed to support Yukon's workforce, and it has sparked national conversations about how a society can come together to better support workers without sick leave. You can find more about all these programs online at yukon.ca. It's absolutely important to know that we have these programs available today, and it's important as well to know there is going to be more programming to come. Our government continues to develop ways to support Yukon businesses because we recognize that the impacts of COVID-19 are ongoing. Just today, we are releasing additional money to Yukon Airline Air North as part of the Federal Aviation Relief Funds. We anticipate having information about new and expanded programs as our response evolves and meets the changing needs of Yukon businesses. In addition to supporting Yukoners and Yukon businesses, our government is also taking measures to protect our territory and to minimize the spread of COVID-19. We continue to enforce restrictions of those entering into our territory. Those transitioning through our territory still need to move through within 24 hours while staying on their designated route. Those coming from outside of British Columbia or the other territories still need to self-isolate for 14 days. These requirements are set out in declarations that visitors must sign upon entry, and they must abide to these declarations. We have laid 3 new charges under the Civil Emergency Measures Act in the last few days. 2 of these were for indoor social gatherings of over 10 people, and 1 was for failure to self-isolate as required, bringing the total number of charges under CEMA to 15. I cannot stress enough how important it is for individuals entering into our territory from outside the bubble to continue to self-isolate for 14 days upon entry. We currently have no active cases of COVID in Yukon, which means the biggest threat is the importation of the virus from another jurisdiction where there still are active cases. Practicing the Safe 6, which includes self-isolating as required, is the best way and remains the best way to keep our territory healthy and safe. All of us, residents and visitors alike, we must do our part to prevent the spread of this disease. We will continue to ensure that these measures are enforced. We all have a role to play, but there is also we also need to recognize that we are all in this together. And I want to remind Yukoners, all Yukoners and visitors, to be kind, to be patient, and respectful to one another. If you have any concerns or issues, please contact our enforcement team at COVID-19 Enforcement at gov.yk.ca or call 1-877-374-0425. Before we move on to Dr. Hanley today, I would also like to take a time to note that the government does continue to work through this pandemic on other issues and programming, and to continue to deliver on commitments that we've made to Yukoners. One such commitment is seasonal time change. We are continuing with the plan introduced in the spring. This plan will see Yukoners staying on our summer time and not falling back this November. Now, more information will come on this, but I've been getting questions as we get deeper into the fall, and I want to remind Yukoners that we have not changed our commitment to this issue. Thank you very much for listening to the update. Dr. Hanley.
Thank you, Premier Silver. I'm sure anyone tuning in now, apart from having monitored the throne speech, have also been watching the numbers as the pandemic surges in various parts of the world, including areas close to home. Recent media coverage has Europe and the US and even Canada on the possible brink of a second wave of COVID-19. Modelling information figures released yesterday by Canada's Chief Public Health Officer, Dr. Tam, show the epidemic is accelerating rapidly. Dr. Tam warned that if Canadians don't continue to practice public health measures, the virus could be expected to surge faster and stronger than the first wave. Projections indicate that cases could climb to more than 5,000 per day, and short-term projections show there could be over 150,000 cases by early October and more than 9,000 additional deaths. Even while we remain free of active cases, I think these projections tell us how serious it is that we continue to follow the Safe Six, that we wash our hands, use hand sanitizer, that we stay 2 meters apart from others not in our bubble, that we stay home and away from others when sick, and that we keep our social circles small. The only protection against COVID-19 is in how we behave. In Yukon, we have only had to manage COVID cases occasionally, but we're continually managing COVID risk. The risk of one COVID incursion that turns into an outbreak, the risk of a case or cluster or outbreak being life-threatening to some, or stretching our health care or our public health capacity. Managing COVID risk means being vigilant while keeping that balance. It means reasonable preventive measures in place that make sense for us where we are, without community transmission, but without having to undergo the restrictions that other areas have faced and are now facing again. If we can keep open, but with Safe Six and with carefully applied measures, we will tolerate cases. We're continually seeking to maintain that balance even while the risk of introduction grows. We have done well, and by holding on to these measures, we will continue to do well, even if we see cases. I have heard already how tiring this is. I've even heard from teachers that doing this in the schools after a month is tiring, and is it all really necessary? I think it is, because if and when we see cases in schools, we can keep going. We can keep schools open and keep kids learning and keep everyone well if we continue to maintain that balance. And just as the second surge or wave may hit, we could also begin to see influenza and other respiratory viruses circulating. If we're lucky, in Canada, we'll experience what Australia and other Southern Hemisphere countries faced, a very low influenza season. But we don't know that this will be the case in North America. As Yukon CMOH, I've always stressed how important it is to get your flu shot. This year, I think we will all agree that it is even more important than usual. Since we can't tell the difference between COVID and the flu by symptoms alone, what we want to prevent is people getting sick from either, and especially from both. There are always lots of good reasons you can choose why to get the flu shot, and this year's tagline for the flu vaccine campaign is, "What's your why?" We all have our different priorities. For some, it's to keep families safe. For others, it's to keep themselves healthy. But this year, part of that why is to prevent the flu so we don't get sick with both at the same time. I'm asking everyone to prevent what they can. And while immunization against influenza is never a guarantee against infection, it still remains our best tool to prevent influenza. This year's flu clinics will look quite different if you're in Whitehorse. In rural communities, they will be more or less the same as usual through the health centres. In Whitehorse, all clinics are being centralized at the Yukon Convention Centre. We won't have the usual array of settings, and even Whitehorse Health Centre will not be the hub for the flu vaccine. The flu shots will be available at the Convention Centre on a drop-in basis with no need for appointments. We're doing it this way to maximize the number of people getting the flu shot, to keep them safe while getting the shot, and to make cleaning between patients easier and faster. Every effort has been made to make this a safe and positive experience. I've toured the centre, and I can tell you they're paying attention to every detail to make this process as smooth and efficient as possible. Further details will be coming in the next 2 weeks. But I can say that the vaccine will be available October 19th for those at higher risk, including those with chronic conditions, and then for the general public the following week. Additionally, this year, pharmacists will be able to provide flu shots in the pharmacies, and they will be announcing their own details to come later. As an additional preparatory step for this fall's influenza season, we've made some changes to the Respiratory Assessment Centre, or the RAC. First of all, the name is changing to the COVID Testing Centre, or CTC. The CTC is now fully staffed to provide COVID testing 7 days a week, with the clinic open from 8:30 in the morning to 6 p.m., and will continue with nurse practitioner appointments as they usually were, which are Monday to Friday from 10 a.m. to 4 p.m. for those who require respiratory assessment or diagnosis and treatment beyond simply testing. I can perhaps remind people again that testing does not always have to be immediate. For most people with mild symptoms, as long as they're feeling well and self-isolating, taking the next appointment at the CTC will be the best way to get tested. Going to the emerge after hours is not necessary, except for those who need to be seen right away. As always, for people with acute shortness of breath or requiring any kind of urgent or emergency care, the hospital emergency department is the best place to go. There were some challenges this past week with backfilling staff at the CTC who needed to be off for various reasons. The Department of Health and Social Services is working with Human Resources to further develop a reliable on-call staffing pool, and we're confident in our ability looking forward to be able to provide testing 7 days a week. The increased hours of the CTC is part of the efforts to boost our testing capacity, as well as in anticipation of possible increased demand during the upcoming influenza season. Last spring, we saw a lot of flu at the end of the season, just as COVID was making itself known. At that time, once testing for COVID was in place, every person tested for influenza was also tested for COVID. With our inability to tell the difference between the two, any signs or symptoms of flu will mean this year a COVID test as well, as it has been throughout. But don't worry, it's only one swab for both viruses. For parents who may be concerned about children having to have a COVID-19 test, we are in touch with the work that has been done in BC to create a new saliva method instead of a swab. It's a gargle and spit method for testing for COVID. The results have been promising, and BC is sharing this information. We're working with our BC lab partners to see just how we could add this option to our testing in Yukon. With this less invasive test for children, it may be a kinder option for kids who might have to be tested multiple times over the coming fall and winter months. So more on that as we get further along that pathway. Testing of children is one issue that has been raised many times, and I've received many letters or emails from families and parents. But this is, I hope, addressed in the traffic light advice that we've issued to schools and to parents. And this has been sent to schools for broad sharing, and it's now also posted on yukon.ca. To go over the pathway briefly, red symptoms mean cough, fever, or difficulty breathing, and that means stay at home until you're both tested and all better. And yellow symptoms mean stay at home for a day and see what happens. If symptoms are single and improve after a day, you can go back to school. No need for a test. A simple runny nose is also fine to return to school with if you're otherwise well. 2 or more yellow symptoms mean stay home and get tested, or stay home for 10 days. The advice for kids under 6, mostly for the daycare audience, is slightly different from that from the older kids and adults. I realize that other jurisdictions are coming up with varying recommendations. We think our guidance is based on a good balance of pragmatism with a low tolerance for symptoms that are more associated with COVID in order to keep COVID risk in schools to a minimum. As always, we will see how well this works to keep the risk low while keeping kids as much as possible in their learning environments and their parents at work. We will continue to monitor and compare notes with other jurisdictions and modify if we need to. Grown-ups have to stay home when they're sick too. Don't try to show how tough you are by going to work. You could be putting your co-workers or anyone else you come into contact with at risk. We are working on specific tools for adults too, but the content and the principles are the same as what we've issued for school children. We have talked about how lucky we've been in Yukon. I feel lucky as well to be part of this community that is so supportive of our efforts to keep Yukoners informed and safe. We will continue to work to maintain the best balance, living with COVID risk while taking the necessary precautions and maintaining our vigilance. Thank you for all your efforts and participation in taking the Safe 6 to heart. And don't forget that important 7th step, be kind. That's all for today. Thank you. Merci.
Thank you, Dr. Hanley. Thank you, Premier Silver. We'll now go to the phone lines, and we'll begin with Haley from Yukon News.
Thank you. My question was for the Premier. I was hoping to get a reaction to the throne speech today, and specifically if you're hoping to implement pharmacare in the territory, and if you're hoping for additional healthcare funding announcements.
Thanks for the question. And again, just heard it in the last hour or so, and so just highlights right now, and I can't pick one highlight necessarily. There were several commitments that are extremely important. Long-term care was part of it, getting people back to work, support for tourism and cultural sectors, an action plan for women, initiatives on climate change, green energy, and of course universal daycare as well. So there's lots of things to talk about, and we'll be waiting for more of the details as we work with our federal counterparts, but cautiously optimistic on a lot of themes here.
Thank you. Do you have a second question, Haley?
Yeah, my follow-up related to that, I don't have the background on the particular issue, but wondering if pharmacare is something that's being considered for Yukon.
So we've seen Ottawa announce pharmacare over a few different political parties over the years. What I heard, which was exciting to me, again, we'll see if there's details on pharmacare, and the devil is in those details. We are moving into the fall into conversations with the Canadian Health Transfer. Those are going to be interesting conversations as well. It was very interesting to hear that the federal government wants to step up into the space of universal childcare as well. So again, whether it's pharmacare or a conversation about universal daycare, or how that pertains to the federal partnership with spending with the provinces and territories. Again, lots of positive things to be said in the speech from the throne. Interesting to see how that translates into action items as we move into the fall.
Thank you. We'll move now to Claudienne, Radio-Canada.
Yes, still on the throne speech, Premier, there was no specifics on a northern package for impact on COVID in the throne speech. Is that a disappointment?
No, not at all. I just met with, over the phone, obviously, with my counterparts, Premier Cochrane and Premier Sigabiktuk this morning. We had a conversation about how the negotiations are going on the Northern Support package side of the restart funding allocations. We're getting there. I would say that we are very close to figuring out the final details on that when it comes to Yukon's Northern Support package, and more to come on that as well. But we're getting there, and I'll be very happy to announce the details of that as we go. I have to give a shout out to all of the premiers right across Canada who recognize the unique circumstances that we find ourselves in the north. We've seen language from the Council of the Federation to support that the territories have unique circumstances. Per capita spending is not, it shouldn't be the only consideration when Ottawa is dealing with packages for specific regions. And, there's some unique cost there. We've been pushing for base plus when it comes to a lot of these envelopes that came out of the restart. And hopefully we'll have some updates and some positive updates tomorrow or the next day.
Thank you. Next question, Claudienne.
Oui, Dr. Hanley, par rapport à la reprise économique, vous mentionnez combien, malgré l'ouverture des frontières avec la Colombie-Britannique ou avec l'Alaska, on n'a pas eu de cas. L'industrie touristique demande à grands coups d'ouvrir la frontière du Yukon avec les autres provinces pour permettre davantage de tourisme réglementé dans le cadre des mesures sanitaires. Pourquoi ne pas ouvrir sur les autres provinces si on n'a pas vu de cas justifié avec la Colombie-Britannique malgré les augmentations?
So the question for Dr. Hanley is, given the economic recovery and the fact that since opening the BC border, we don't have more cases than we had in the past, are you considering the possibility of opening the border with other provinces and to permit more of this economic tourism to trickle through the Yukon?
Merci, c'est une question très importante et peut-être la première réponse c'est que juste un rappel que c'est le gouvernement qui réagit et qui fait cette sorte de décision basée sur une partie au moins sur l'avis que je peux ou les conseils que je peux fournir. Et pour moi, c'est une question pour toujours considérer, pour non juste pour le tourisme, l'industrie du tourisme, mais pour une société le plus ouverte possible, mais équilibré ou balancé avec un risque, une réduction des risques prudents basé sur le risque d'importation. Donc, on suit les critères, les 6 critères qu'on a décrits qui incluent le risque d'importation et la capacité de santé, la capacité de santé publique, si on a des cas, la transmission locale et comment sont les mesures en place et comment ils sont suivis, les mesures comme la Secure 6. Donc, c'est toujours toute cette formule basée sur ces critères qui est en balance. Pour le moment, je pense que c'est pas le bon moment d'ouvrir plus. Et peut-être il y a 2 raisons. À part de critères, il y a 2 raisons, je pense, plus visible. Une, c'est que on est en train d'augmenter significativement. On a une augmentation significative dans tout le pays. Donc, c'est peut-être pas le bon moment d'ouvrir plus. Et la concentration, c'est de rester en place avec ce qu'on a maintenant, la grande ouverture avec Colombie-Britannique. Et de, même qu'on a démontré qu'on peut le faire, c'est toujours, on est en train de gérer un risque d'importation plus grande. Et le deuxième, c'est que le fait, malheureusement, le fait, c'est que les Canadiens sont pas en train de voyager. Les Canadiens restent pour la plupart sur place. Donc, et c'est cette sorte de conversation est en train d'avoir directement avec les représentatifs de tourisme du Yukon. Donc, on a parlé directement de ces faits-là. Et pour le moment, on reste sur place, mais toujours on examine les possibilités pour le futur.
Thank you. We'll move now to Philippe from CBC.
Yes, hello. I am wondering if there are plans to expand flu vaccination in the community. We've seen pharmacies in Whitehorse offer the service and the expansion Dr. Hanley mentioned. Will anything be changing in communities outside Whitehorse?
Yeah, thank you. That's a really good question. We don't have pharmacists in rural communities on the question of pharmacies. Also, by and large, the availability of flu vaccine in the rural communities tends to be greater. The means to be able to efficiently give flu vaccine in the rural communities is really, the capacity is already there. So it's really just a matter of organizing more or less along the lines previously that previously are well practiced. It's definitely much more challenging giving flu vaccine in the urban center of Whitehorse, just dealing with a large population with all of these factors such as availability of appointments, a large population converging on relatively small centers, parking, all of these issues. So it's really, the logistical considerations really do focus on our one large urban area and are much less. So really, basically normal practice should take care of everyone who needs vaccine in rural communities. The timing will be the same. The concentration on higher risk people for the first week, public for the second week. But things tend to go a lot more smoothly in rural communities anyway, naturally, just based on that capacity and smaller populations.
Thank you. Do you have another question, Philippe?
Yes, it's been a long while since we checked in on the availability of personal protective equipment. I just wanted to ask Doctor, how you feel the healthcare services have them. Do we have access to enough masks and protective equipment these days?
Yeah, and I don't have the exact numbers at my fingertips, but we are we're in a solid position, I would say. We were of course facing shortages as the rest of the country was in the earlier days, and putting mechanisms in place to centralize the acquisition of PPE and the inventory, and to make sure that we were keeping track, had maybe better and more timely systems in place for keeping track. And then of estimating projected needs based on different usage and projected usages based on the different facilities, particularly the hospitals, but also other users such as physician clinics, community nursing, of course, and First Nations usage in the communities. So, all to say, the aim with also with federal support was to develop a 12-week inventory of PPE, and I know that we're heading well towards that target. I know that we have at least 6 weeks as of a few weeks ago, so we're really heading to that. I think a comfortable place, but where we are towards that 12-week target, I can't tell you, but we can bring that back to you.
Thank you. Before we move on to the next questioner, Dr. Hanley, we've had a number of requests for you to respond in English to the question that Claudiane asked about the borders.
Sure. So the question, as I recall, was the question was about especially responding to the needs of the tourist industry and with a purpose to looking for more possibilities for increasing tourism. Are we looking at further border openings beyond the BC bubble? And so I guess I gave a fairly long answer, but to summarize, the one thing is I wanted to make it clear that that's always a government decision, and it, of course, a lot of that government decision depends on the advice that I give based on the work of our team and our analytics. Roughly, that we have 6 criteria that we're as in the path forward. We do use those 6 criteria, which include importation risk. So that's, what is the number of travelers coming in from a particular place based on COVID prevalence, based on how we're doing locally, adherence to public health measures, public health capacity, healthcare capacity, presence of community transmission or not. So all of those really factor into that decision. And we're also at a time where we're recognizing that tourism is, and even as in the national news this morning, tourism just isn't happening a lot, and that is kind of the stark reality that Canadians aren't traveling. So no matter what measures might be put in place, it's a difficult time for tourism at the moment. So we just have to recognize that is a reality. The other stark reality is that although we want to do our best to maintain our open borders with BC, this probably isn't the best time to be recommending further openings. And I know I've mentioned this on several of my recent media updates that we're continuing to look at an increase in cases, significant now increases even at the point of a potential large surge in cases in many other jurisdictions. So definitely importation risk is going up at the moment. So again, it's all a matter of trying to find that right balance where we've done a lot. I mean, just in opening up to BC, that was a big move, and yes, we've demonstrated that we were able to do that, and we've done well with it. But is this the right time to make that next move right when we're on that real second upward curve? So this is a time to be a little bit more careful. And for me, it's a matter to watch, see what happens. Where will we go? Will we get over this curve and then be able to reevaluate that importation risk compared to the other criteria? And then what are the opportunities? What are the potential benefits? And let's get some more thoughts and analysis around that. So that's the other point that I didn't mention in French, but I'll mention in English, is as I said, I think even a month ago, our real focus now is getting kids into schools. We're now a month into that, and doing that safely. We're still working out a lot of kinks. Kids and teachers and staff are still kind of getting used to that, and that's definitely been a prime focus. And again, I think in view of rising epidemiology, perhaps not the best time to open up further.
Thank you. We'll go now to, apologies, Premier Silver.
No worries. Thank you, Pat. I just wanted to add on to that, thanks for Brennan Hanley clarifying the recommendations come from the Chief Medical Officer of Health, policies come from governments, and whether that's federal governments or territorial or provincial. I thought Pierre Germain did a great job representing the Tourism and Culture Department this morning on local news, speaking about, breaking down the numbers. 70% of the tourism that we rely on in the Yukon is international. And as folks know, the international borders are a federal decision to be made as well, but again, based upon the recommendations. And it's been a very difficult season for tourism. What I'm hearing from industry, they would much rather be working than getting support from a government, and I really appreciate that. I was just in Dawson, where the impacts continue to be felt throughout the community there as well. Our government has taken early action to support local businesses, and we're going to continue to work closely with the business community to understand, and that's the big thing, is understand how we can continue to support local communities to find out who's falling through the cracks as we have restart money or local support money from our departments now. I do want to give a shout out to Sandy Legg, the general manager of Wilderness Tourism Association of Yukon. I was told that she was busy, going out and speaking to a lot of different tourism sector businesses. And this type of information coming back to us is extremely important as we design programs to work with those industry stakeholder folks. And we're going to continue to work with TAIA. We're going to continue to work with local businesses. It's not the most optimal time. There was a survey done of Canadians. 7% of Canadians right now are willing to travel outside of their regions, and these are the realities we're in right now. And as we're in the last stage of recovery and before before a vaccine, we are seeing increases in the epidemiology and being very concerned, and we are in a pause. To predict the future is something we can't do right now, but at the same time, we are there to support the seasonal businesses. We are there to support the tourism sector.
Thank you. We'll go now to Marine from Aurore Boréale. Marine, are you with us?
Oui, merci. C'est une question pour M. Silver. Dans de nombreux domaines, même au-delà du tourisme, le Yukon dépend de l'immigration au niveau du recrutement. Par exemple, dans le domaine de la petite enfance francophone, comme juste pour un exemple. Est-ce que le gouvernement prévoit d'aider les entreprises et les organisations qui vont souffrir des conséquences de la fermeture des frontières internationales pour recruter, pour les ressources humaines?
So the question is for the Premier. A lot of businesses are using immigration as a way to recruit personnel to fulfill some of their needs, most importantly in early childhood care. Is the government going to be able to help these organizations to be able to fulfill their needs in terms of recruitment?
Excellent question. And we've been working with a pilot project on the nominee program that's been very successful. We have supports out there for folks in the nominee program. And we've been working with the college, the university, when it comes to international students. Our desire is to help support students who are here now growing roots into Yukon as well. This has been a conversation on the federal stage as well with the premiers and with the First Minister's meetings. It's something we continue to monitor. I think what we're noticing in Yukon and right across Canada as well is we need more people to be in employment and especially when it comes to really important fields like early childcare. This is not babysitting. This is professionals providing professional services, professional education and support for our earliest of Yukoners, our youngest of Yukoners, and it's extremely important. I'm very proud of the work that the team is doing in immigration, and we'll continue to support folks that are in Yukon, First Nations governments, municipal governments as they battle with trying to figure out how to put people to work in their communities, put Yukoners to work, but also work with immigration to add to our population with new Yukoners.
Thank you. Avez-vous une autre question, Marine?
No, merci.
Thank you. We'll go to Tim from CKRW.
Hi, good afternoon. Both of you may want to answer this question, but Dr. Hanley, you'd alluded to about people going to work, don't be a hero. I mean, it is September now. People may be out of sick days. They may not be able to take 1 or 2 more days off, or they may not be able to fall under a territorial program. What do you suggest to both employers and employees who may be faced with this situation?
Yeah, well, I'll certainly let the Premier respond to potential solutions and supports, but this is a big area, and I think it's another one of those barriers and potential barriers to being able to being off work when we're prevailing upon people to be. So this is one of the realities we have to struggle with. I think we're really, again, pleading for that. I think for the problem that we have to be addressed, and that is, this is public health safety first and foremost. And I think if we are able to efficiently apply the right criteria, we can at least minimize unnecessary staying away from work, but really highlight where this is really important. So taking that 24-hour pause, assessing symptoms, and then getting tested when appropriate, and then making sure that the testing turnaround facilitates return to work when symptoms clear. So really making sure that we have really robust and consistent direction and pathways to support rapid resolution of these dilemmas, and including rapid resolution to work when able to do so. I think that's a big part of that kind of public health process. And so that means clear guidelines, consistent guidelines, keeping up with changing literature and changing evidence, and maintaining testing capacity. The other aspect, of course, is ability to work at home. So when people are well enough, as much as the work environment allows, being able to to encourage that flexibility and being able to carry out work at home, whether it's the kids who are sick or the adults who are sick, but not to duck from that being a real reality that as a society I think we have to better address. So I'll hand over to the Premier.
Thanks, Dr. Hanley. It's definitely something that we took seriously from the very beginning. It was one of our first support programs when folks were getting tested right away. It was extremely important. We know that our government has sick leave provisions. We want to make sure that expanded out to other businesses that didn't offer it, or even folks that are self-employed, like artists, for example. It's an important question, but I will say, the program's undersubscribed. I haven't heard of a lot of people tapping out or topping out on the service. We know that the national government as well is looking towards modeling, what we've done here in the Yukon with a national program. It's being met in different jurisdictions from different premiers with different levels of interest, I guess. But I think here in the Yukon, those who needed it, they applied. And what we need to make sure is, if it's undersubscribed, is it undersubscribed because people don't need it, or just because people don't know about this program or know that it's available for non-government, private sector, self-employed individuals? And we're going to continue to do that analysis and make sure that our support programs fit the unique needs of Yukoners.
Follow-up, Tim?
Yeah, actually, my follow-up is quite scary. I'm just wondering your Halloween guidelines, when you're going to be coming out with those. I know a lot of parents are kind of wondering when those guidelines will be coming out.
Yeah, I don't like those scary questions, but we're on it. It'll be in time. It's actively on the table right now, so I can't promise it for next week, but I will promise it'll be available in time for the goodies.
Thank you. I'd like to thank everyone for their time today. Our next COVID-19 update is scheduled for Wednesday, September 30th at 2 p.m.